Lip tie, tongue tie, and reflux. What should you know about this? Let's talk about this today. My name is Olga Dolghier. I'm a board-certified pediatric dentist and sedation dentist here at Palm Valley Pediatric Dentistry and Orthodontics. Lip tie and tongue tie reflux. There's so many questions we have. It's very difficult to have a clear type of cut indications and answer to this topic. It's a very big, controversial topic. To break it down to simple terms, what are tongue tie and lip tie? Can they be related to reflux? Tongue tie and lip tie is a string of tissue which attaches lip to the gum tissue and tongue to the floor of the mouth. Some kids who have severe lip and tongue tie struggle from multiple problems. Number one, infants, they cannot suck effectively, they cannot transfer milk. Mom is struggling, baby is struggling. Number two, we see some correlation to speech problems. If the kids are severely tongue-tied, the range of motion of the tongue is limited and they cannot pronounce certain sounds clearly. Number three, some studies shows that there is a correlation between reflux and tongue-tie. It's controversial. There is no sufficient evidence yet which can relate those two to each other. On a clinical level, sometimes after tongue and lip release, we do see improvement on that side as well. But as I said, it needs to be researched more. Also, tongue tie and lip tie can affect the way child sleeps. If the tongue is extremely tight, then child tend to sleep with the mouth open. When the mouth is open, they breathe through the mouth. We should breathe through the nose through the mouth. Remember, mouth is for eating, nose is for breathing. When we breathe through the mouth, we cannot filter a lot of different type of environmental pollutants or dust. As a result, our tonsils getting enlarged. There is a correlation between mouth breathing, obstruction of the nasal cavity, and increasing in size of the tonsils. As a result, child start to snore and they breathe more through the mouth. So there is a pattern between those two. There is some study which shows correlation between restrictions of the tongue and not positioning the tongue off the roof of the mouth during sleep and difficulties breathing at night. So to answer your question, needs more research. We still just in the beginning of this process. Those things I mentioned is just new studies, it's accidental findings. There is some clinical cases, but there is no good double-blind study which can prove that tongue tie, reflux, tongue tie, speech, tongue tie, large tonsils are related. More research needs to be done. But don't stop on that. Keep researching, keep doing a good job with that, because finally, when we know the new topic, when we find the right research, when we do new study, then we can come up with a new conclusion and maybe change the way we think about certain type of situations and diseases. So airways are extremely important on children. The way child sleep is extremely important. Children who cannot sleep deep at night, they're tossing and turning, they have multiple problems. ADHD is one of them. If your child cannot get good night's sleep, they cannot rest enough, and as a result, we see signs of ADHD. If your child cannot sleep deep enough, their memory is impaired. Some of the kids bedwet for a long period of time just because they cannot breathe good at night, because they cannot sleep well. So this whole pattern of those type of problems still needs more research, but we are in the beginning of this huge discovery and I'm really excited about it. Share with me. Tell me if you have child with tongue and lip tie, if they had releases, did it improve their life? Did it improve their breathing? Did it improve reflux? Let me know. Please send me questions if you have one about this big topic. I'm looking forward to hear about this. Thank you.